Melbourne, if there's a call to be made, when would you make it? What are you looking for?
We just keep the evidence under review here, so we're getting updates every couple of hours from our Australian counterparts. Our teams are working very closely together. My message to New Zealanders last night was we don't have enough information at this point to make a decision on whether or not a pause should be put in place. It's possible that there won't be a pause, but if you're sitting there thinking if a pause happens, I can't afford to be stuck away from New Zealand, then it would be prudent to make your way home.
Are the Victorians confident or they don't know?
At this point, we haven't got enough information from them to make our own judgments on whether or not a pause might be necessary. And so, as a precautionary measure, we're just indicating that to New Zealanders who are in Victoria that a pause is possible. We don't yet have enough information to say whether or not it's probable.
Reasonable upset into this station from people going, hold on, all these people stuck in Australia, you said they'd be on their own. Now they're not. Now you're giving them, MIQ room. Do you regret your initial statements or do you regret doing what you're doing now?
No, what we said at the time was that in an emergency situation, we would make some MIQ space available. We set aside 500 rooms for that. But we also said that that would not be our first response, and it hasn't been our first response. The people in New South Wales have been there for some weeks now, and they're likely to be there for some weeks more. They're not all going to be able to come back immediately. Some of those people will end up being there for several months before they have the opportunity to come back to New Zealand.
Now, is it correct to say that when you come back, you get an MIQ room with your ticket, right?
That's the way we're managing it for New South Wales at the moment. Yes.
Why don't you do that for everyone?
It's quite difficult to do that globally around the world, and it does mean that we ultimately end up determining how many people are coming from which countries and so on. So the MIAS voucher system, which we've got at the moment, is a fairer way of doing the allocation of tickets. Almost every way that we've looked at to do room allocations for MIQ, there are strengths and weaknesses in all of the different systems that we could use.
Okay, can you explain to me, I don't know, I mean, I'm looking at these so-called ghost rooms. For example, in July, 72% of rooms are used. In June, it was 67%. May, it was 57%. April, it was 67%, thus indicating there are lots of rooms not used. How is it that there are people overseas not being able to get a room when there are clearly rooms there?
So people haven't had difficulty until the last week or two in getting rooms. And so you will have heard me say back in May, if you're in New Zealand and you want to come home now because the rooms are available. We're now reaching the period where we've got peak demand again. Demand's going back up. We've got some rooms that have been offline because while the demand was low, we've taken them out of circulation in order to do maintenance. But these hotels have been being used for over a year now, pretty consistently. They need some work done on some of them. So we've been doing that while demand is low, and that does keep the number lower. And the move to cohorting means that you do end up with some extra rooms that sit empty because once the hotel reaches the end of their 72-hour filling up period, if they're not full, those rooms just don't get used for that 2-week period.
Is there a better way?
Look, we've looked at every way. Now, cohorting gives us additional risk protection. We've actually eased back on the cohorting while we were having to accommodate people coming back from New South Wales to free up those extra rooms. But cohorting does decrease the chances of COVID-19 spreading within the facilities.
Right. Are we paying for the empty rooms, by the way, that aren't being used?
There's a variety of different payment methods with our providers. We pay them, if you like, a base fee for availability, and then we do pay them an occupancy fee for rooms that are occupied.
Right. Now that I've got you at last, tell me, was there ever the opportunity for this country to give Pfizer $40 million for a priority payment to get more vaccine sooner?
No, that option's certainly never been given to any ministers, and as far as I know, never was on the table.
Could you ask for it?
We've made the decision that we would be in the global market. We weren't willing to pay the price that some other countries were willing to pay in terms of sharing our citizens' private health information with Pfizer in exchange for early access. That was the trade-off that Israel made. Yep. We weren't willing to do that.
You could have, but you chose not to.
We didn't even explore that possibility.
Because you didn't want to.
We weren't willing to put that on the table. No.
Okay. Now that we know that Jacinda Ardern has spoken with Albert Bourla, the head of Pfizer, a couple of times, has she lobbied for more vaccine or not?
The overall conversations there were about how quickly can we get those vaccines. So we know we're getting the vaccines we need. We just want to see if we can get them sooner, and that's what they've been in the tone of those conversations.
And so far you failed on that?
There has been some movement in our delivery schedules based on from what we were previously told, but it has not been big movement. Pfizer have international demand, very high international demand that they're having to balance.
Are you putting us first, or are you putting other countries first?
Look, New Zealand is certainly first in terms of our priorities, but of course we are working with the Pacific as well to make sure that they are getting access to vaccines. We are doing our bit globally through COVAX and being a contributor there.
But I look at van der Leyen from the EU, I look at Trudeau, I look at the aforementioned Netanyahu. They all ring baller. They get hundreds of millions, if not billions, of vaccines and solve their problem. We don't seem to be able to. Morrison doesn't seem to be able to. How come?
Look, that's ultimately a question for them. We're doing what we can do to get vaccines into the country earlier.
But I noticed yesterday Mr Ardern said in a foreign policy speech that we need to emphasise countries do not hog vaccines to ensure that all countries are vaccinated to reduce the risk of new variants. So you're placing the importance of vaccinating other countries right up there with vaccinating us, hence we're so slow at 125th in the world.
No, I think what you could read into that statement by the Prime Minister is that we won't be keeping vaccines in the freezer and preventing other countries from accessing them if we're not using them. So in terms of our decision to use Pfizer, it has meant that we have been able to on-donate AstraZeneca, for example, which is a vaccine that we're not going to be using to other countries and make it available to them.
So you're arguing that you're prioritising New Zealand as much as any other country or more than any other country?
Oh, no, New Zealand is our number one priority. There's no question about that.
Even though we're 125th in the world, and going backwards, by the way, since last week.
Look, ultimately, there's an international supply constraint around COVID-19 vaccines. We're doing everything we can to get the Pfizer vaccines that we are using. We're doing everything we can to get them into the country as quick as we can. We got more delivered this week than we had anticipated, and that's good news. But we continue to push hard to see if we can get more.